Doug Ford's plan to privatize healthcare started way before the pandemic, and we've been letting it slide for far too long. And it's gotten to the point where it looks like Health Canada is going to have to get involved. Because, yes, our healthcare system is being privatized. People are now having to pay to go see a doctor. And remember that virtual visits used to be covered. We're going to come back to that at the end of the video. Like, it all started off as fun jokes. You know, when Doug Ford originally got rid of sedation for colonoscopies, we were like, oh, well, let's see what happens when Doug Ford has to get one. And then it quickly escalated into the Ontario government slashing $1 billion from Toronto Public Health, where a city councillor warned people will die, and guess what? They did. And on top of cutting that $1 billion from Toronto Public Health, the Ontario government had also underspent in terms of healthcare by $466 million prior to COVID-19. And this is coupled with the fact that somehow they either lost or mismanaged billions of dollars given to them by the federal government specifically for healthcare. So through a combination of malice and incompetency, the Ontario healthcare system was already in a precarious situation, which Doug Ford made worse during the pandemic and with Bill 124. And during the pandemic, we had a first-hand taste of what the last round of privatization under Mike Harris had in store for us, as thousands of people in private long-term care facilities across the province died in horrible, awful, disgusting ways. It was so bad, not only did we have to call in the military, but many military personnel had PTSD from what they saw. People dead or close to it, covered in their own feces, dying of starvation or having already died of starvation. So it's also not a shock that during this current round of privatization, when Doug Ford says that we're never going to have to use our credit card, he also allows for us to be upcharged. Like, you don't have to pay, but if you want the baseline level of care that people in Ontario have been accustomed to for over 40 years, you're going to have to pay. And Ford also knows that this is only going to exacerbate the staffing shortages that we're seeing in hospitals. Like, does anyone else find it insane that we expect nurses to work overnight, work these 12-hour shifts, and we don't pay them more when they are working these insane, ridiculous hours? And if nurses now have more opportunity to go work at private clinics, we need to be paying them more if they are working these insane shifts, because otherwise nobody is going to want to work overnight in an ER that is understaffed. And conservative voters keep acting like, oh, well, you know, we haven't tried privatization yet. It could work even though it hasn't worked anywhere else. Except they also fail to acknowledge the fact that you can't go backwards from this. You can't undo privatization at this level. Like, for example, remember how Doug Ford took virtual doctor visits away from OHIP? That has led to literally thousands of trans kids across Ontario without proper access to healthcare. With this one clinic alone servicing 3,500 people. People who otherwise would not be able to get proper gender-affirming care where they live. But I guess it's no surprise that Doug Ford doesn't care about trans people, because he doesn't care about anybody other than his billionaire donors. Like, just go look up the connections between Doug Ford and the Bachner Eye Institute. And let's not forget that private means for profit. These companies are going to have to turn a profit somewhere. OHIP does things at costs. Where are these private companies going to make their profit from? They are going to either cut corners or underpay people or overcharge people or overcharge the government or confuse elderly people into being upcharged on things that they didn't necessarily need or want. So let's be clear. All Doug Ford wants from our healthcare system is to funnel public dollars into the hands of the wealthy elite. He does not care about you or your family.